Great.
All right. So I'm an occupational therapist, and I'm here to talk about occupational therapy in rural or remote settings. I've included my contact information. I'm always available for people to reach out if they have questions or concerns about anything around OT and how to access it in your own communities. So, in terms of my own background, I grew up in Edmonton, but I did move to Ontario and completed my degree from Western University in occupational therapy in 2004. I personally am based in London, Ontario, but I travel throughout the province. I'll show you in a moment some of the areas that I cover in the work that I do. And so I'm a community-based occupational therapist. I've worked pretty much exclusively in the community since I graduated 20 years ago. And so I work with anybody who ranges from school age children all the way through adulthood and into the seniors. So the areas that I personally cover and have worked in so far have included areas as far north as Port Elgin, Southampton, all along Lake Huron here, so Kincardine, Goderich, Grand Bend, Sarnia, all the way out to Windsor and down along the north shore of Lake Erie, Simcoe. Whoops, sorry. I have gone out as far as St. Catharines, but that was kind of a unusual, kind of a one-off client. Brantford, Kitchener, Waterloo, and Cambridge for sure. Going up along Listowel, Hanover. And I've also been up in further north in Thunder Bay and Red Rock last summer doing some assessments for medical malpractice files. And I also, when I was doing my own personal clinical placements back when I was a student at Western University, I chose to do a placement up in the north of Ontario. So we were based out of the Timmins Community Care Access Center. So that was like publicly funded community health care. And we also traveled out during my placement to Kapuskasing and Hearst, which are some of the areas out in that area. So occupational therapy is, I'm just going to try and, I'm going to try and reduce that so that you'll be able to see. So occupational therapy is a field that many people don't have a strong understanding of until they've actually had an opportunity to use our services. But essentially the word occupation is not just restricted to work settings. So like occupational health and safety, generally people think of as being like a workplace safety program. But in occupational therapy, like our professional understanding of what occupations can include, that can include self-care, so taking care of yourself, getting dressed, having a shower, feeding yourself, productivity, which could mean going out to work, could mean doing things that you need to do around the house, like yard work, housework, volunteer, leisure, so activities that you do for fun, and taking care of others. So those are some of the things that occupational therapists can get involved with. So if you've ever had an occupational therapist or if you have a reason to have an OT working with you, then usually that would be because you're having some difficulties completing any of those kinds of activities. So we tend to focus, whereas like physiotherapy, and as Dagny did a great job of explaining about how physiotherapists tend to be very hands-on, looking at an individual person's injured tissues and trying to kind of bring those up to maximal function. Occupational therapists are looking more at the bigger picture. So we tend to take a step back. I don't tend to do a lot of hands-on work with my OT clients, but I do look a lot at what their limitations are. So that would mean the person thinking about what are their physical, their cognitive, their emotional difficulties, what kind of environment are they needing to do activities in, and what are the activities that they need to get done. So what kind of health conditions OTs can treat? I just pulled this off of the Ontario Society of Occupational Therapists website, but could be anything from acquired brain injury, amputations, anxiety disorders, low vision, all the way through to spinal cord injury, stroke. In terms of my own background, most of the clients that I work with have included clients who have chronic pain, orthopedic injuries. I've worked with people who've had hand injuries and needed splints. Also mental health issues like depression or PTSD, anxiety, concussion or brain injury, low vision, autism or developmental delays, spinal cord injury, and amputations. So pretty wide range of different kinds of health issues that I have worked with personally. And so if you were to see an occupational therapist, where would they be meeting with you? Well, they might meet with you at your home, or if you were residing in a long-term care facility, they might come out to see you there. They might also work with you in hospitals or clinics while you're receiving other kinds of care there. They might come out to see you at school or in your workplace, and also at different locations in the community. Like, for example, some of the clients I work with, I might take them out to problem solve around some difficulties they might be having with grocery shopping. So I might be going out with them out into the community and doing some grocery shopping with them. Or I might support them at government offices, like getting a health card renewed, or taking them to a doctor's appointment and making sure that they have somebody who's a well-informed advocate on their team who can, basically provide some good detailed communication and relay that onto the team about what's going on with a particular situation that the medical appointment was arranged for. So in terms of access to OT, so similar to DeJaegars' different streams of funding that can help out with situations that involve physiotherapy, some OT services are covered by OHIP. There's also various kinds of insurance that might be involved. So a lot of the clients that I work with have either been in a motor vehicle accident, so there's insurance on that side that pays for my services, or WSIB if they've had a workplace related injury. Some of the clients I work with also have just extended health benefits through their employer, and they might need some supports to help them manage through those that stream of funding. Employers, so some employers feel like it's just good business for them to make sure that their workers are well taken care of, and that they might ask me to come in and do an ergonomic assessment for a number of their workers to make sure that the work site is as healthy as possible and everybody can perform their tasks as smoothly and easily as possible. And sometimes people just pay out of pocket because they have a particular issue that they really want to address with myself. So an initial assessment that an OT would do would be looking at a person's physical functioning. We also will address cognitive functioning. So how is somebody thinking? How's their memory? Are they able to problem solve, make decisions in an efficient way? And how's their emotional function and regulation? We would also potentially look at what's the client's home, workplace, or school environment looking like. Is it well set up to meet their needs, or is there something that can be improved on that side? And looking at the activities that need to be performed. So we're looking at the activities that a person wants or needs to do in that environment, and how well are they able to do them or not. So basically kind of problem solving on that functional level on how somebody's managing day to day. So the assessment, if we've done a good job of our assessment, it should answer the question, what tasks are difficult that this person wants or needs to do? Why is it difficult if there are problems, and what would help? So in some cases, what we would be looking at in terms of treatment is always going to be very individualized. We would be looking sometimes at providing equipment. So it might mean providing a bath chair to help somebody get in and out of the shower, like a bath bench. If somebody can't weight bear and they need to be able to get in to be able to shower, but they have a broken leg, it could be something just like a more comfortable, well-fitted, ergonomic work chair for them. So I'm looking at getting delivery and installation by local vendors. Not all of the clients that I work with are going to be serviced by London-based vendors where I'm coming from. And so I'm going to be doing research when I go out to see clients to find out what are the local companies that are available to do equipment installation, rental, and retail. I might also be providing some coaching and education on strategies to manage their symptoms. Sometimes we provide programs, either exercise that could be physical or cognitive, setting goals for daily activities. And I'm also going to potentially be recommending other local services. So maybe a personal support worker should be coming out and helping you with getting dressed in the morning, or maybe you should be seeing your local physiotherapist. So I might be recommending to somebody, if they don't already have a physiotherapist on their team, I might be making that recommendation, or referring on to speech pathology if there's cognitive issues or feeding issues. There's other team members as well that sometimes we refer to. So within a rural setting, though, there's some things that are different about working with clients in a rural setting, because occupational therapists are really interested in the environment in which we do the everyday activities that we do. The kinds of activities that even get done by somebody living out in a rural setting might be different. So, for example, the actual rural occupations that I have seen clients be involved with, and that I've helped them to potentially get equipment to help them manage more effectively, include things like farming tasks, hunting, trapping, fishing, boating, horseback riding, dirt biking, snowmobiling, ATVing. All of those tasks are not necessarily the kinds of activities that people who are living in the city would have access to. So there are definitely some different occupations that I'd be looking at within a rural setting. One of the earlier things that I put on that slide was also the fact that I do need to consider travel time and frequency of sessions. So if somebody is going to be, a 3-hour drive or a plane ride for me to go and visit, is there funding for me to come out and see them? Do they, how often would we reasonably be able to meet? Are there some virtual options too? Like once I've done the actual in-person assessment, sometimes I can do follow-up sessions virtually and get the local vendors to do the delivery and installation of the equipment. Other things that are involved in thinking about rural setting, clients living in rural settings, are like, what kind of social supports and distances are involved? Somebody in, a city setting might have a family member or friend who lives in the apartment building right across the hall, whereas, in this situation in a rural setting, somebody might have their adult child or daughter who lives up the road, but it might still be a 45-minute drive. So obviously there's a different level of support that you'd be expecting when somebody has those kinds of distances that they're dealing with when it comes to daily supports. I need to find out who the local vendors are who are providing equipment or services. What are their skills? How soon can they make it up to this given location, given that, travel time that might be involved for them as well? And what are some other local service providers and therapies that are available in that particular center? Given that I'm just kind of coming in from the outside, I really need to connect somebody with their local supports. Larger properties certainly need more time and different equipment to manage. So like for somebody in the city who has a little postage stamp lawn, an electric battery operated lawnmower might do the job. But for somebody, for example, who's living on the rural property, like you see in the photo, you're going to need a riding lawnmower at the very least. And, a bent handle ergonomic shovel is not going to do the job for clearing that kind of driveway. So, and also another issue that does come up is just around transportation and ability to drive. So what do we do to support clients who want to continue to live in their homes in rural areas, but where they, may have limited access to transportation, and maybe they're not medically eligible to drive anymore? So there's some hard conversations that sometimes come up around working with clients who are living in these areas a bit more isolated and who need to be able to get around. So anyway, that's basically all that I have to talk about for now. So thank you very much, and I'll pass things over to Lauren.